Hi, I'm Dr. Williams from Columbia Pike and Town & Country Animal Hospital. Today, I'm going to be talking to you about cat medication. For cats, we commonly are prescribing medications a lot of the time for pain. That's a pretty common presentation especially in the ER where I am usually working. We also prescribe a lot of antibiotics depending on the need for the cat. Common causes of antibiotic need tend to be upper respiratory infection, as well as a lot of skin infection. The way you would safely administer it would depend ideally on the route of administration. We typically are going to prescribe home a pill or a capsule or even a liquid medication. One common concern that a lot of cat owners have in particular is they don't think that their cat will let them medicate them, and there's sometimes fear that their cat may bite or scratch them. We often recommend, especially in the beginning time, to have two people to help administer the cat. That way we can have one person holding the cat and the other person able to quickly get the medication into their mouth. Very much would depend on the type of medication you're talking about. Oftentimes there may be an injectable alternative that your veterinarian may be able to provide for you. Depending on the type of medication, there are some commonly reported side effects. In antibiotic, most commonly we are hearing about a GI upset, usually vomiting or diarrhea or decreased appetite. With commonly prescribed pain medication, a lot of the time it's advisable to monitor blood work, including checking their liver and their kidney function before making sure that it's safe for that medication. There are some over-the-counter human medications that are safe for your cat. However, we would not recommend that you administer any over-the-counter medications until you get approval from your doctor. Common adverse reactions to medication can include facial swelling, trouble breathing, GI upset, lethargy, decreased appetite, and much more. If you're worried that your cat is having an allergic reaction, then we recommend seeking emergency care as soon as possible. When we prescribe your medication to you, we should be giving you instructions about how to store your medication. Depending on the type of medication, we may recommend keeping it in a dark, cold place, or we may recommend keeping it in the refrigerator. It's very medication specific, and we recommend following the directions on your prescription label and from your veterinarian. Oftentimes you can, but that would depend on the type of medication. There are some pills, including antibiotics, in which that could actually impair the antibiotic's ability to be as effective as it typically would be. Ask your veterinarian before you crush the medication. You may notice that your cat needs pain medication if you notice some of the following behaviors. Constant licking, especially of their limbs in older age, can be a sign of arthritis. Other common presentations of pain can include vocalization, whining, and acting needier and following their owner around more than usual. A very commonly prescribed feline medication for anxiety is gabapentin. This is a human medication for pain, and in cats it can cause a bit of a mild sedative effect and lower some of their anxiety. We commonly administer it prior to a visit to your veterinarian, which can help alleviate some of their fear before going into the office. If your cat was put on an antibiotic, for example, we would typically hope to begin to see improvement within 48 to 72 hours. Depending on the reason, that may not be the case, but if you are not noticing any response to treatment within about a 2 to 3 day period, then you may want to follow up with your veterinarian to make sure that there's no other additional medication they should be put on. Thank you for watching this video. If you have any questions at all, don't hesitate to reach out.